Our today's topic is anemia, which is not only important clinically, but also it has significant importance for any exam that you appear. So what will be the objectives of our today's learning? First of all, we will know about the definition of anemia, classification of anemia, anemia's causes, anemia's symptoms, lab investigations of anemia, treatment and prevention. Now let's talk about the definition. An means without and anemia means blood, is a decrease in the RBC count, hemoglobin and or hematocrit values resulting in a lower ability for the blood to carry oxygen to body tissues. Now let's talk about the classification of anemias on the basis of causes, on the basis of morphology. There are different types of accepted classifications of anemia. On the basis of causes, blood loss, inadequate production of normal blood cells, excessive destruction of blood cells. On the basis of morphology, normocytic, microcytic, and macrocytic. Now we will talk in detail about all these types of anemias. Types of anemia. Based on clinical picture, iron deficiency anemia, megaloblastic anemia, pernicious anemia, hemorrhagic anemia, hemolytic anemia, in hemolytic anemia, thalassemia and sickle cell anemia, and aplastic anemia. Iron deficiency anemia. It can cause from excessive loss of iron. Women are at risk because of menstrual blood loss and growing fetus. Megaloblastic anemia. Less dietary intake of vitamin B12 and folic acid. Red bone marrow produces abnormal RBC. It can occur from cancer drugs. Pernicious anemia. Inability of the stomach to absorb vitamin B12 in small intestine. Normochromic normocytic anemia. Normal mean corpuscular hemoglobin concentration. Normal mean corpuscular volume. This includes anemia of chronic diseases, hemolytic anemia, those characterized by accelerated destruction of RBCs, anemia of acute hemorrhage, aplastic anemias, those characterized by disappearance of RBC precursors from the marrow. Hypochromic microcytic anemia, low mean corpuscular hemoglobin concentration, low mean corpuscular volume. This includes iron deficiency anemia, thalassemia, and anemia of chronic diseases. Normochromic macrocytic anemia, normal mean corpuscular hemoglobin concentration, high mean corpuscular volume. This includes vitamin B12 deficiency and folate deficiency. Hemorrhagic anemia, excessive loss of RBC through bleeding, stomach ulcers, and menstruation. Hemolytic anemia, RBC plasma membrane rupture, may be due to parasites, toxin, antibodies. Thalassemia, less synthesis of hemoglobin found in population of Mediterranean Sea. Sickle cell anemia, hereditary blood disorder characterized by red blood cells that assume an abnormal rigid sickle shape. Aplastic anemia, destruction of red bone marrow caused by toxin and gamma radiation. Now we will discuss some common causes. Increased requirements, menstruating female, pregnancy, lactation, growing infants and children, erythropoietin treatment. Increased loss from GIT bleeding, menorrhagia, persistent hematuria, intravascular hemolytic anemias, regular blood donors, parasitic infections. Decreased intake, vegetarian diet, socioeconomic factors. Decreased absorption, upper GIT pathology like celiac and Crohn's disease, gastrectomy, medications like antacids and Zantac. Anemia caused by iron deficiency. People with an iron deficiency may experience these symptoms. A hunger for strange substance such as paper, ice or dirt, a condition which is also called pica or pica. Upward curvature of the nails referred as to koilonychias or spooning of the nail. Soreness of the mouth with cracks at the corners. Anemia caused by vitamin B12 deficiency. People whose anemia is caused by a deficiency of vitamin B12 may have these symptoms. A tingling, pins and needles sensation in the hand or feet, loss of sense of touch, a wobbly gait and difficulty walking, clumsiness, stiffness of the arm and legs, dementia, hallucination, paranoia, and schizophrenia. Risk factors. poor socioeconomic class, multiparity, teenage pregnancy, menstrual problems. If you have liked the video, please hit the like button and subscribe to our channel.